You find us here on the Randox stand at MEDLAB Middle East 2024, where I'm joined once again by Scott McKeon. Scott, good to see you again at MEDLAB Middle East. Randox, of course, a familiar name to many, maybe not to everybody though, but maybe you can just fill them in. Tell us a bit about your expertise in the diagnostic sector.
Sure. Yeah, thanks, David. Randox is a 40-year-old diagnostic company with expertise across a broad range of areas of healthcare. For example, our quality control products, our IQC, are market leading, first to market and only a market for a few different products that we're going to speak about and we're promoting and talking to distributors and both end users about at this show. For me personally, the product line that I look after or oversee is for our near patient diagnostics. So the likes of this device, our evidence multi-stat device, as well as some of our other platforms. And we're really here to meet with existing distribution partners, existing customers, but in addition to that, to meet and engage with new distribution partners. Always room for growth in the market, and this is a good place to do it. So we're here to do that as well. And also show and really through some of our workshop exercises this week, we're going to be telling end users and distributors just about how we're shaping and how we're developing new tests that will really impact patient care, both in terms of management and treatment.
Quite a presence at the show, as always, and you brought new product here this year as well. What can you tell us about what's new here for Randox in 2024?
Sure. As I mentioned briefly earlier, one of our bread and butter product portfolios is our quality control materials. So we're inviting our customers and we're inviting our distribution partners to come and hear more about some of the products that we've got that are new there. So in our IQC, which is our internal quality control products, we've got a couple of new, first and only in market for active vitamin B12. Also some other for serum indices. So we're really trying to push that market of people think QC. Is there more to go with QC? Absolutely, there is, and we're pushing forward in that sector. So that's one of the products. One of the other products we have is our internal quality assessment, our IQC software for statistical analysis, really showing how well laboratories are performing internally, so they can review that within the labs. Lastly, if I can say briefly, I'm here representing our near patient diagnostic portfolio, and one of the devices in that is our evidence multi-stat platform. So this is about bringing diagnostics closer to the patient, closer to that point of need. And so we have a number of new applications on this. So it's well established in the market for toxicology and drugs of abuse, also food safety testing. But where we're really pushing the boundary now is bringing sort of risk stratification, data-driven risk stratification assays, which help the clinician to really assess which patients need to be referred for some procedures and which can be deferred and brought back for screening in 3-6 months' time. So we're looking at assays like that in the areas of kidney dysfunction, big problem, particularly in the Middle East. And it's quite sad. About 90% of the people who have kidney dysfunction don't know that they have it. So we need better screening methods, and that's where the multi-stat will come in.
And is that where your product portfolio really fits, really complements your presence here in the Middle East?
Yeah, absolutely. Cardiovascular disease is still the number one cause of mortality in the Middle East, and kidney dysfunction is linked very closely to that. Most people end up knowing that they've got kidney dysfunction at some level, usually when it's at the end stage, and at the end stage it manifests in a cardiac event. So that's how they end up in hospital. So what we're really here is to go, okay, there are better ways to early screen, manage patients better, treat them better as a result of that, not just for kidney dysfunction, but other conditions, such as stroke, looking at other conditions in the cancer world, so prostate cancer, bladder cancer. We are bringing together this concept of taking soluble biomarkers, coupling that with clinical risk factors from patients to give a risk score and a way for doctors to better manage outside of hospital, actually, as much as in hospital. So we're excited about that. We're excited to talk about that.
We're excited that you're here to have that conversation with visitors to MEDLAB Middle East. As always, Scott, terrific to have you here. Thank you very much indeed for sharing your products and indeed your insights with visitors here at this year's show.
Thank you, David. Pleasure as always.